Hi everybody, I'm Dr. Mitch and I'm here as an ambassador for the Joseph P. Cory Foundation, making lives better everywhere. The subject for today is how do we develop or implement preventative medicine? Really, what does that mean? Well, to someone like myself, it means how do I stop A, getting a disease, and B, how do I stop getting older in the idea that I don't look as good, I don't feel as good, and you know my expression, also don't have as good sex. Look good, feel good, have great sex, that's what it's about, isn't it? Yep. So prevention truly means a method of being able to take our cellular network, our 100 to 200 trillion cells, and keeping them healthy and in a state where they are doing their work unimpeded. Now let's think about that for a moment. How do we do that? Well, we have to make sure that A, the cells have all the necessary things to make it work properly. Well, what do cells have to make it work properly? Think about that. Well, if we look at the Krebs cycle, 1965, Dr. Krebs showed us the cycle. Every doctor in the world studies it, but it somehow forgets it after a couple weeks. And that cycle shows that there is a certain group of chemical reactions that are occurring day in, day out, constantly. And those chemical reactions are based on, no, not chemicals you don't know, they're based on nutrients. And if you look at that particular chart that every doctor studies, every healthcare professional studies, it's calcium, magnesium, copper, manganese, essential fatty acids. The list goes on and on, B12, folic acid, etc. And there are no medications in that at all. So the way we are constructed by the Creator is to be able to have enough of this material so that the body, with proteins and the proper amounts of carbohydrates, can not only reconstruct and reproduce itself, but reproduce healthy offspring as well. That's prevention thought one. But you know, it's life. And with life, we get exposed to stuff. We get exposed to metals. We get exposed to things that we breathe in. And we have work, and our work exposes us to other things. So part of that is to remove or to get out the things in the cell that are creating the workload for that cell not being as easy as it was before. In other words, if the cell could do its work like an 18-year-old, we're great. But after time, it's unable to do that. We also want to make sure that not only is this cell itself healthy, but surrounding it. Cells live in a little thing called a niche. They live in an environment. That environment supports them. Much like us, we live in a home. We have the proper cooking utensils. We have the things that we need to help us stay healthy. We have things around us that support our living and keep us happy. Well, the cells have the same, no different. And then we need a means of communication, whether it's our cell phone or whether it's the communication somehow to get us to talk and speak to other cells. We need that as well. Now, how do we determine that? Is that an X-ray? No. Is it an MRI? No. Is it a CAT scan? No. How are we going to know? So we have to know through certain things, one being blood tests, which can determine the chemistry that's individual for each person. Now, everyone's different. There are optimals of blood tests, and everyone needs to be within their optimal for their age, for their height, for their weight, but we also want them in the optimal for a much younger you. Second thing we want to do is determine, are the things that allow us to talk cell to cell, are they working good too? Can we measure those? Yes. We can measure them through functional tests like blood, saliva, urine. We could determine if there is anything inside these cells. Is this typical part of what you see when you go to the typical family physician or primary care physician? The answer is, of course not. And it's not because they don't want to do the right thing. It's because they don't know. And there are very, very good, accurate, specific tests to determine who you are. Basically, just like we do a thumbprint or a new retinal scan, we could determine your metabolic scan, so to speak, so we could determine who you are. Now, if I'm correct in what I'm saying, then there should never be an always or never in my vocabulary when it comes to treating someone. It shouldn't be the same thing for him, same thing for him, same thing for him, same thing for him, and everybody gets the same thing. If that were the case, it would be robotic medicine like much of Western medicine now. It should be based on his deficiencies, his difficulties, his problem. Now, let me offer you a new theory of how to do this. Let's do that. A typical physician, and this is how we're trained, is we get a history of the person, we get a physical diagnosis, and then we do some diagnostic studies, x-rays, etc., to support what we believe may be the diagnosis. And then we come up with some treatment plan. What I'm saying is we do things differently. And the new model is we get a history, a physical, the regular diagnostic test, but now, here's where it changes. We also get diagnostic tests that are functional to look at what's happening inside the cell, outside the cell, around the cell. And in today's day and age, we can also check the genetics of that person. Do you have more chance of getting a colon cancer? Wouldn't that be great to know? Do you have more chance of getting a prostate cancer before it happens? Wouldn't it be amazing to know? And then we have the model for prevention. Because now we know what's coming or could come or have a proclivity to come, and our focus of prevention won't be just a shot like a immunization. It'll be focused towards that system. And I don't mean at all if we said someone had a proclivity or chance of getting colon cancer to do more colonoscopies, because again, that's structural. I'm saying, what do you do if you're a farmer? If you're growing weeds, what do? You look at the field, you check the soil, you decide what's missing, you put the nitrogen in, the potassium in, you fix the soil. And again, the model's saying the same thing. Can we fix that soil and make it so instead of a weed growing and have to try to cut the weed after it grows, but to protect, make, and fix the soil so that you grow a beautiful crop? That's what preventative medicine is. For the Joseph P. Cory Foundation, Ambassador Dr. Mitch here.